Welcome to Plymouth Hospital's NHS Trust Children's Theatres. We have made this video to help you to understand what will happen if you come to us to have an operation or test. Plymouth Children's Theatres has a separate entrance to the side of the main entrance to Derriford Hospital. We may have asked you to come to a pre-op assessment appointment, or one of our nurses may ring you instead. At the pre-op assessment appointment, a nurse will check we know all about you and your health. The nurse will give your mum, dad, or carer some information for you to look at together at home. If you come to the hospital, they will weigh you so we know how heavy you are. You may also be able to meet a play specialist to find out more about going to sleep. When you come to hospital for your operation, one of our receptionists will check we know your name and address. You might be asked to wait for a little while. First, one of our nurses will check you are all ready for your operation. They will usually put some special numbing cream on your hands, held in place with a clear plaster. They will give you a name band to wear. They will also check your temperature in your ear and your heart rate with a little peg on your finger. If your doctor has suggested you should have an operation or test, you will probably be having a general anaesthetic. This means you will be asleep and not able to feel, hear or see anything during the operation. You will get to meet your anaesthetist who will look after you while you are asleep, and your surgeon who will be doing your operation. They can explain what will happen, and you can ask them any questions you might have. Sometimes the surgeon needs to draw a mark on your skin. This will wash off later. There are two different ways of going to sleep, and your anaesthetist will explain which is best for you. When it is time for your operation, you can bring an adult with you while you go to sleep. If you have a favourite toy, then bring that too. We even have iPads with videos to watch or games to play while you go to sleep. A nurse will bring you to the anaesthetic room where you go to sleep. Your anaesthetist will be there and will check your name band before you go to sleep. If you're having gas to go to sleep, your anaesthetist will ask you to breathe through a mask which sits over your nose and mouth. After a few breaths, you will go to sleep. If you've had the magic cream on your hands, then your anaesthetist will put a tiny tube in the back of your hand. The magic cream means you can't feel it. You can play on the iPad while this happens, and your mum, dad or carer will stay with you. When the tube is in, some special medicine in the tube makes you go to sleep. Your mum, dad, or carer will wait nearby whilst you are asleep, and when you wake up they will come to you in the recovery room. Once you have woken up properly, you can go home or to the ward if you are staying in hospital. Thank you for watching our video. We hope it was useful, and please look at the rest of our website if you would like any more information.